Please say hello to Dr. Courtney Day.
Thank you. So the title of my talk is Healing from Morgellons Disease, an evidence-based functional medicine approach to diagnosis and treatment. So I'm going to tell you a little bit more about my personal journey from becoming a Morgellons patient to becoming a naturopathic doctor. So where my journey began was in around 2007. I noticed I had some skin lesions that would not heal, but at the same time I developed neurological symptoms, cognitive and memory decline, very shortly having graduated from California Polytechnic State University, San Luis Obispo, with a bachelor's degree in microbiology. So it was very noticeable to me the difference in my cognition, considering I had just graduated from college. My first visit with a dermatologist didn't go so well. I didn't know ahead of time, but my mother had contacted him previously and let him know a little bit about what my symptoms were like, and that she was talking to me about something that I had discovered called Morgellons disease, wondering if that had to do with the illness. So unknown to me, they had an email exchange prior to my visit, which I think led him to even be more dismissive of my symptoms. The physical exam was very minimal. There was no dermatoscopic exam provided, and all attempts to provide photographic evidence proved unsuccessful. When I personally mentioned Morgellons in the visit as a possible etiology, the dermatologist admitted to having at least a dozen cases a year present to his office, but he still made the diagnosis of that I had something called, most likely something associated with obsessive compulsive disorder, and that I would really benefit if I just stopped picking at my lesions, and actually recommended that perhaps I should use handcuffs as a treatment. Handcuffs, so that I wouldn't have the urge to pick at my skin. Thinking more about my history, I had been in contact with several microbiologists at that time because I was selling microbiology equipment. And one of them mentioned to me that she heard an association of my symptoms with Lyme disease. And just thinking more about my history, I did have a strange rash that I presented with in December 2004 to a nearby emergency department near Dallas. Unfortunately, as you are probably most of you are aware, they do not believe that Lyme disease really exists in Texas. So unfortunately, even though I had my insect bite in California, it was not brought into consideration in the emergency department. I did not receive a diagnosis, but I was given a 10-day treatment of doxycycline, which I remember very well because the appointment actually made my mother miss her flight to Hawaii because we were all about to go to Hawaii for Christmas, and I had to spend the whole entire trip indoors because of the photosensitivity. Okay, so my early days of treatment, prior to even realizing that Lyme disease was associated with Morgellons, I found a great benefit from detoxification strategies. I noticed an improvement in overall symptoms, improvement in my cognitive function and stamina. I was able to get well enough to actually enroll in naturopathic medical school, but my symptoms continued to wax and wane despite the continued detoxification strategies and treatments that I was doing at that time. So when I started naturopathic medicine, it was a healing journey for myself as well. So the 6 principles of naturopathic medicine are listed here. The first one is the healing power of nature. As naturopathic doctors, we believe that the body does have an innate mechanism to heal, and a lot of our modalities are centered around trying to promote that natural healing process. The second tenet is to identify and treat the underlying causes of disease, which I think Morgellons disease is a great example of this, because yes, we can diagnose you as having a group of symptoms and treat all of those symptoms, but until you really understand what the underlying cause is, you're never going to get better. And that's what I discovered on my own journey. So the third tenet is first to do no harm. I think this should be a major part of all medical training, that before we do anything with our patient, we want to make sure that we're not causing them further harm. The fourth is doctor as teacher. So naturopathic doctors often spend much longer with their patients in patient visits because they understand the idea that our role is really as a teacher. Doctor actually means to teach. And without teaching our patients why they are ill and why they became ill, we can't expect them to fully recover. The fifth tenet is to treat the whole person. So we all know that we have this, in this room, are diagnosed with something called Morgellons disease, but I can't just give you one treatment for every single person in this room, because every single person in this room is so completely different. You have to really treat the whole person and take an individualized approach. The sixth tenet is prevention. So I think this is a great example as well of a disease that could be prevented. And there are a lack of effort, I think, right now in the public arena as far as getting governments on board and the public on board so that we can have prevention efforts that can actually prevent future cases of Lyme disease and Morgellons disease. In my training, I also was introduced to the Chinese medicine approach. So in Chinese medicine, they have recognized a Lyme-like illness for quite a long time. The earliest mention in Chinese texts comes from the classical Chinese literature, where they describe a syndrome called Gu syndrome. The symbol is just pictured right below. It's a worm in 3 vessels. And the idea about Gu syndrome is that it's translated to mean like a chronic possessive type of infection with bacterial and parasitic pathogens. In Chinese perspective, they think of the chronicity of the infections similarly to an analogy of oil pouring into flour. So when the oil first starts to seep into flour, you have a chance to scoop it out, to save the rest of the flour, to eradicate whatever has started to seep in. But once oil starts to really seep into flour, it gets to a point where you cannot separate the two, that it's become such a part of, or such a congruent part of each other that you can no longer fully get all the oil out of the flour. And so that's how the Chinese, classical Chinese medicine doctors view chronic Lyme disease and chronic parasitic infections, is that we might not even have the chance to eradicate them all fully at this point, but if we strengthen the body and strengthen the reserves, that recovery is possible. So a naturopathic treatment approach considers all treating the whole person. And so one of the things that really made a huge difference in my health as I went through school was dietary changes. So our school is sometimes almost teased a little bit because of the fact that so many students who start the program, if you compare your diet before you start the program and then you compare it to after you finish, there's usually a drastic change in the students that go through the program, because our naturopathic school really encourages the students and the doctors to try things like allergy testing and elimination and reintroduction as a way to see if there's a response in chronic symptoms. And so many of my classmates and myself as well noticed a benefit from taking things out of our diet. And my main foods that seemed to cause a lot of inflammation particularly were gluten and soy. And then reducing dairy intake also helped a whole lot, and increasing organic and whole foods. So another tenet of naturopathic medicine is homeopathy. So homeopathic medicine is a part of naturopathic medicine, and you can use constitutional as well as acute homeopathics to treat symptoms. I had a great benefit myself when focusing on constitutional homeopathic treatments that are intended to remove miasmatic layers and can help with not only overall symptoms but mental and emotional health. And I've noticed a great benefit myself from certain remedies, like arsenicum album, for example, helped me to be able to speak in front of people. Before I had Morgellons disease, I loved presenting and I loved acting and I loved talking in front of people, and that all just disappeared as soon as I got sick. And it wasn't until I took that particular remedy that I felt comfortable talking again. Another example is the homeopathic remedy silica. Silica is used to help extract things that are stuck in the skin. And I noticed an overall benefit from that remedy as well. There's also intravenous therapies that can be used. And I noticed a benefit myself from some of the more oxidative therapies. So major autohemotherapy, which uses ozone, and UV light therapies as well for blood irradiation have been very helpful. And my whole journey really shaped my diagnostic approach as well. So I want to walk you through the evidence-based functional medicine approach that I use with my patients. So when I go to assess a patient that I suspect that has Morgellons disease, I spend a great amount of time gathering medical history, including the progression of physical symptoms and exposures. It's really good to get a timeline of symptoms as well as different exposures. I find that in the majority of cases, Morgellons patients not only have Lyme disease, but often other exposures and illnesses that have affected their health. I also like to review family history and pet health history because there are, as the other practitioners have shared, sometimes this does become a disease that infects the entire family and can affect the pets as well. And they might be also a reservoir for the disease. A complete physical examination, including a dermatoscopic exam, is done on all my patients. I assess for psychiatric symptoms, including history of physical or emotional trauma, PTSD, and adverse childhood experiences. This comes from Dr. Horowitz's teaching, but I do find it to be true that if there is a huge amount of emotional trauma in a person's life, it can make it much more challenging for them to fully heal. So that needs to be addressed as well, the mental emotional aspects. And then also understanding the socioeconomic status and their insurance status and their social and family support is huge because it really shapes the treatments that we're able to do with patients. So unfortunately, some of my Morgellons patients that have the most symptoms, and some of them I end up seeing pro bono because they cannot afford for any care, are also the most challenging patients because often when they have government health insurance, it can be extremely hard to get prior authorizations on the medications that they need. So I like to use Dr. Horowitz's Lyme questionnaire for assessing the multisystemic infectious disease syndrome. That's his model in approaching treatment. I do find it to be very useful. When I assess a Morgellons disease patient, I'm guilty of I'm getting a reputation in Oregon. Pretty much every phlebotomist knows who I am now because of the amount of bacterial, fungal, viral infections and parasites that I work my patients up for. I assess for environmental exposures and toxins, evaluate the organ systems, immune function, check for things like autoimmunity that can happen as a result of chronic persistent infections, screen for nutritional and mineral deficiencies, consider allergies and sensitivities, and then there's genetic analysis that you can do for things like human leukocyte antigen susceptibility, and you could look at single nucleotide polymorphisms. Those all will affect things like methylation and detoxification. So I'm going to just talk first of all about testing for the infections. So for bacterial infections, I listed the ones that I tend to screen for here. I have found some Morgellons patients come back positive with brucella. And whether or not it's a true brucella case, I have not had that confirmed yet. I have some suspicion that some of these infections also might cross-react with brucella antibodies. Fungal infections, candida can be very common in Lyme patients and Morgellons patients and needs to be treated at the same time, especially if we're going to be starting an antibiotic course that will only make fungal issues worse. Often these patients have parasitic infections, but they can be very hard to diagnose. A lot of them will respond to antiparasitic treatments even if we cannot identify an actual parasite present. And then viral loads is something I'll look at as well. A lot of these patients have quite high viral loads or reactivated Epstein-Barr virus. So I want to share with you some of the tools that I've come across more recently that have really enabled me to make more diagnosis with patients, especially when it comes to GI pathogens and parasites. Similarly to the problems with serology testing that we talk about with Lyme disease, there can be issues with serology and with testing for other infections as well, just by the fact that it's reliant on that immune system response. So you're really checking the immune system when you're checking for infections. If you use PCR testing as a way to amplify DNA from the organisms, then you're bypassing the immune system and you're getting you're checking what for presence that's there in the gut rather than looking for the immune response. So sometimes you're able to identify things that you wouldn't otherwise. So this is an example of Diagnostics Solutions GI Map DNA stool analysis. It's the most comprehensive stool analysis that I know of. It goes through bacterial pathogens, parasitic pathogens, viral pathogens, H. pylori, including virulence factors, normal bacterial flora, opportunistic bacteria, fungi and yeast, viruses, including CMV and Epstein-Barr virus, protozoal parasites, and I will say that this is just an example of the GI map report, so it shows no protozoal parasites present. But in many of my Morgellons patients, I've been finding quite a high protozoal parasite load, and this is even after doing rounds of anti-protozoal parasitic treatments. Worms can be detected on this as well, and then they do the intestinal health panel that gives you inflammation markers as well. So Epstein-Barr virus is something that I'll find reactive in many patients as well. I like the PCR stool analysis because it can actually check to see if there's DNA present that they can find in the stool. Otherwise, it's hard sometimes to interpret the lab results to know whether or not a patient is suffering with chronic reactivated Epstein-Barr. But this is just a summary of the different types of antigens that will increase and decrease over time with that infection. So the majority of my practice is Lyme disease, and so I was very excited when Dr. Klinghardt came out with a protocol for diagnosing and treating chronic conditions with a particular focus on Lyme disease using PCR analysis. This paper describes his method of using PCR testing along with something called autonomic response testing that I do in my office as well as a way to help increase the diagnostics of Lyme disease. So what this method does is it uses a combination of tools including ultrasound to provoke organisms from areas that they are hiding in the body and drive them into the bloodstream, into the urine, so that we can detect them more easily. So DNA Connections is a lab in Colorado Springs that's doing a urine analysis PCR for 3 strains of Borrelia, 3 strains of Bartonella, Babesia, 3 strains of Babesia, Ehrlichia, and Anaplasma. So here are some of the results that I've been getting back on my patients. This is a 37-year-old female in Oregon. She was one of the first, I think, that was tested that shows several. So every organism that's highlighted on the test is a positive result. If it has an NSA designation next to it, that means it was a non-specific amplification product, so it's not an exact DNA match to the organism. So that is, so how we do, when we do PCR, you use primers to amplify DNA, and then you'd expect a certain sequence to be a specific size and length, and also have the same sequence as the organism. So because there is some diversity over time of the genetics of the organisms, they do report products that have been amplified by the primers that are not exact matches, and then go ahead and sequence those. And so talking to Leslie Douglas, who runs this lab, she's now collecting a profile of sequences, and the majority of the sequences are over a 95% match to the DNA of the organisms. So you can see for this patient, she did have an exact match for Babesia divergens, Babesia duncani, Bartonella bacilliformis, and then there's some indication that maybe the Hensley species is there as well. And then a non-specific match for Borrelia burgdorferi, as well as Borrelia recurrentis, and exact match for Ehrlichia. This is a 68-year-old female from Oregon, and you can see that she is also quite positive for several species with exact match for Bartonella Hensley. Oh, I would like to mention that some of these patients that I am testing have received antimicrobial treatments previous to doing this test. Others are testing without having any antimicrobials. But I didn't see a huge difference in patients with the DNA, the positives coming back with patients who had been through treatment and those who hadn't. So that just, to me, highlighted the persistence aspect of these infections, and that perhaps we were not giving the patient a full treatment, even though we thought we were treating the patient, because a lot of these patients had come to me from very Lyme literate doctors and had done extensive Lyme protocols, but still were not recovering. So this is a 47-year-old female in Oregon. You can see that she has a Bartonella bacilliformis exact match. And then 37-year-old female in Oregon, exact match for the Borrelia burgdorferi F7 protein. This one is a patient that only came back with a non-specific amplification for Borrelia burgdorferi F7 protein. So you can see that even though this is a more sensitive test, it still can, it doesn't necessarily mean that it's a perfect test. And in this patient, she did respond to Bartonella treatments quite well. And then this is a 58-year-old female from Oregon who has two proteins, Borrelia burgdorferi F7 and Borrelia burgdorferi OPS, outer surface protein C, that are exact matches, as well as the Bartonella bacilliformis. And here is a 44-year-old female from Oregon who has similar results. This is a 72-year-old female from Washington that has the Borrelia and Bartonella bacilliformis species. A 46-year-old female from Oregon who also has the exact match for the outer surface protein C and a nonspecific amplification for Bartonella Hensley. And then this is a 78-year-old male from Washington. I do notice that I have a higher amount of female patients than male patients in my clinic complaining of Morgellons disease, but I do see male patients as well with this. He had a nonspecific amplification for everything except for the Bartonella bacilliformis species. So I do agree with the rest of the practitioners who said that they think that Morgellons has more to do with Bartonella even than Lyme disease. That seems to be something that I notice as well, that there tends to be a good response to treatments for Bartonella. And you can see that Bartonella are closely related to the Brucella organism, as well as the Rickettsia and Ehrlichia organisms. So there is a chance that those Brucella titers are false positives on my patients. So primary infection strategy of Bartonella is shown here. I think other doctors have covered this as well, that it's actually easier to get an infection with Bartonella than it is with Lyme disease, because there are other vectors besides ticks that are known to spread it, as well as biting flies and fleas. And there's cases of Bartonella throughout history. So the trench war was caused by Bartonella, or the trench fever in the war. So pathogenesis of Bartonella. So Bartonella is a infection that can cause inflammation, especially in the connective tissue, and lead to coagulation disorders. So how this happens is first you get the infection, and then your body is going to react to the infection and create inflammation, a cytokine response. And then fibrin deposits and biofilms form, and that can impair blood flow. And then that's how you end up with symptoms. So it's really a collagen vascular disease. So symptoms of collagen vascular diseases can be muscle pain, like myalgia, joint pain, peripheral neuropathy or migratory neuropathy. You can get tremors or muscle fasciculations, headaches, fatigue, decreased stamina, and you can even end up with something called dysautonomia, or postural orthostatic tachycardia syndrome, which can be a result of low pulse pressure changes in the body. So I wanted to show this picture because I think a picture says 1,000 words. So this is, I have to give credit to the University of Minnesota for this, and also thank Dr. Robert Mazzagnani for sharing this. So this is a picture of Bartonella detected in a non-lesional skin of a symptomatic patient using confocal microscopy. And you can see that the shape of the organism, it doesn't look like it's something that would be very comfortable to have in your skin. And this is how it can really lodge into areas of connective tissue, and that's why you can feel that Herxheimer reaction or pain as you're doing treatment because of the organism being so lodged into the areas of connective tissue. So clinical signs of Bartonella hensleyi in a Morgellons patient. So here's some pictures of what you can see appear. Sometimes patients will report spontaneous scratches appearing on the skin. There's a characteristic type of presentation you can see on the skin sometimes as well, with so more horizontal stretch marks that are redder in color than the skin rather than lighter in color than the skin. And then sometimes you'll see little cherry angiomas as well present. So principles of antimicrobial therapy for Bartonella. First of all, it seems like treatment has to be a long duration. So at least 6 months or more is typically what it takes for symptom resolution. Conventional antibiotic protocols do not seem to work, unfortunately. The ones that are published as this should be the treatment that treats Bartonella in just a few weeks, that doesn't really seem to be the case. Oral antibiotics are preferred over IV antibiotics. Because there is an intracellular versus extracellular permeation that you have to think about here. So because Bartonella is inside cells, it's an intracellular infection, you need to use agents that can get inside the cells. So some of the best combinations of antibiotics are double intracellular agents. And I think that's part of the reason why patients don't see as much of a response to things like penicillin classes or bicillin injections or IV Rocephin like you would normally see with chronic Lyme disease patients, is that they need that intracellular treatment. And then you have to consider your agents, whether if they're bacteriostatic versus bactericidal. A lot of the antibiotics that we use for Bartonella have induction or inhibition of the cytochrome P450 system, as well as they influence the adrenal system. So there's protocols that you can use to try to balance that out. And then we also have to consider when we're treating it whether or not an infection is resistant or if it's persistent. So a lot of doctors who are not familiar with Bartonella and they're seeing a patient go through Bartonella treatment, they'll bring up, oh, well, I think that you're giving you too many antibiotics. They're just going to be creating resistance, and that's why you're not getting better. There's resistance to this treatment. But actually what it ends up is that a lot of times there's more of a persistence aspect to this, that the long duration is actually needed to get rid of the persisting organisms. So there can be quite a bit of complications when it comes to treating Bartonella, and it makes it very challenging as both a treating physician and as a patient. So I really try to counsel my patients before I start Bartonella treatment that they should expect to feel worse before they feel better. So it can cause severe deep pain in the connective tissue, and that usually happens about 1 to 2 weeks after starting an antibiotic therapy, or when we increase antibiotics to the therapeutic doses. So often I'll start my patients on lower doses. So for example, for Bartonella, we often use the combination of azithromycin or clarithromycin and rifampin. But we'll start with one antibiotic and then and add the second antibiotic a week later. And sometimes you don't see the Herx reactions until you add the second antibiotic or until you increase the dose of the second antibiotic. So but I often will see that with Bartonella patients, so I really will counsel them well about that they should expect that type of reaction, and try to tell them that that's a sign that this is actually a good thing, that the treatment is able to penetrate into the connective tissue and able to cause the die-off where it's needed. You can get immune deposits from that cytokine reaction, and that might increase the joint pain and arthralgia. Bartonella can be associated with biofilms, and that can cause even deeper collagen-related inflammation. And then there's complications with treatment that can decrease compliance, just what I was mentioning to you. There's just some patients, they tell me, you know, Van, I thought I was doing bad when I had Bartonella, now you're giving me this treatment and I'm so much worse, I don't think I can do it. So I have some patients who it's been really, really challenging trying to get them to comply with treatment. For testing for Bartonella with antibodies can be very misleading too. So a lot of Lyme literate doctors will start Bartonella treatment when they suspect that there's a Bartonella infection, because it's often that we do not see the antibodies actually show up positive until we start treatment. So this is a graph from Dr. Mazzagnani, who talks about the timing that he typically sees of the IFA titers increasing during treatment. And then you really have to evaluate organ systems, immune function, and autoimmunity when you're dealing with treating patients with Lyme, Bartonella, Morgellons disease, because the organ systems are going to be can be compromised to begin with, and they're going to be affected more by starting treatment. So I'd like to do a good assessment to understand whether or not a patient has any issues with their thyroid or adrenals, because those often need to be addressed before we can even start treatment. Then do a full assessment of all the organ system functions so we can support treatment as best as possible. There's also immune function changes that happen with Lyme disease and Bartonella, and that can include changes in the complement activation system, the natural killer cell activity or counts, vitamin D, the way that it's regulated in the body and its conversion to calcitriol. It can affect the T regulatory cells and their counts, as well as the total immunoglobulin levels and IgG subclasses. So those will be things that I'll screen for in my patients, are the signs of immune dysfunction. And then autoimmunity can be a big part of this too. So checking things like the ANA and rheumatoid factor, thyroid autoantibodies can be very important and often needs to be addressed before or during or as we're doing treatment. Otherwise, there can be it can lead to non-compliance. And then immune response in prolonged exposure to Lyme disease has been studied. This is one reason why not only do we have to do antimicrobial treatments, but often also support the immune system through the treatment. And then autoimmunity can be induced by Lyme Borrelia. So that's been known for quite a while. Here's just a journal article from 2004 that summarizes that. And then doing a nutritional and mineral assessment is important as well. So often I'll find vitamin deficiencies in my patients that need to be corrected. Often, almost all patients have essential fatty acid deficiencies where their omega-6 to omega-3 ratio is off. I find that a lot of patients benefit from increasing their intake of choline, which is one of the nutrients that we need for our nervous system. And then minerals can be off balance. Often I see the zinc-copper ratio off, and that can even be a sign of something called cryptopyruria, which can happen as a result of having chronic persistent infections like Lyme disease. And then other minerals can be off as well, like selenium that's needed for the thyroid, or molybdenum that's really important for detox, and iron, which is needed to prevent anemia. So I always check for these things, as well as things like protein, amino acid analysis. And then heavy metals is a big thing here too. I've noticed a lot of my patients have high heavy metals. So you can look for that in the red blood cell analysis or serum analysis. Often naturopathic doctors will use something called provocative testing, urine testing, so that we can compare levels of heavy metals before and after giving some sort of agent that's going to chelate them and provoke them out of the urine to get a better assessment. And then there's the HPU, or cryptopyruria testing that I had mentioned earlier. And then now there's even tests that you can do to look and assess for the amount of chemicals and pesticides that patients have been exposed to, as well as look at things like mycotoxins and mold. So I like to do an environmental assessment for my patients to make sure that they're not being exposed to dangerous mycotoxins in their environment by using the ERMI or EMA testing. I do nasal culturing for Morgellons, which is a methicillin-associated resistant coag-negative staph that's associated with mycotoxin exposure. And then urine mycotoxin testing can be useful as well. So here's just a typical environmental exposure type of questionnaire that I'll give to a patient when I'm trying to figure out if they've had exposure to things like mold or insect bites. This is an example of the ERMI index score to compare. So what the ERMI test does is it compares its environmental relative moldiness index, so you can compare your home or any building to the other buildings and homes in America. So this is coming from Dr. Shoemaker. I use Dr. Shoemaker's work in my practice as well to help assess biotoxin illness symptoms. So Lyme disease can cause biological toxins as well as mold exposure, and the more that these toxins accumulate in our body, the more symptoms can develop. So I often will use this as a screen for biotoxicity levels. There's actually a statistical analysis that can go into this symptom cluster groups that you see here. So even though it looks like random groupings of symptoms, there's a statistical analysis that you can do. If you were to match one symptom in any of these boxes, that would give you a more likely chance of having a biotoxin illness. I do. I use the visual contrast sensitivity test to screen for this as well. You also want to consider allergies and sensitivities. So gluten reactions like celiac disease or non-celiac gluten sensitivity can often be a driving factor of inflammation in the body. Other foods or inhalants, depending on individual allergies. So I like to do IgE and also IgG testing on my patients to test for allergies and sensitivities. Chemical sensitivities are reported often by Morgellons and Lyme patients, as well as some patients really have significant electromagnetic field sensitivities. So you can assess for those, as well as dental and surgical compatibility issues. So I've had some patients really benefit from getting changes done to the materials that are in their dental areas so like dental implants changed or materials for crowns or fillings changed. And then I've also had patients benefit from things like getting breast implants removed, especially if they find out that they're one of the patients that are responding to silicone. Yes, people who work in dentistry, because especially if you're not working in with biological dentists who use equipment to properly remove mercury, that will give you a higher or more of a mercury exposure. Yes, I'm about to. So here's an example of the Clifford test. And this is just my test I would gave you as an example. So in my history, for example, I knew since I was about 5 years old that I couldn't really wear metal. I got my ears pierced when I was 1, but around 5 years old I kept asking my mom for gold earrings, which I can see on my, my metals testing that gold seems to be one of the only metals I don't react to. I'm also in my own history, one of the vaccine-injured children. So back in the 80s and early 90s, when it wasn't even very popular to not do vaccinations, several doctors recommended that I stop vaccination series because of severe seizure reactions. And then looking at my report, the thimerosal group is on there, so that wasn't very surprising. Autonomic response testing is one way that you can try to help to determine sensitivities without doing a lot of extensive lab work. So this is a comparison they just published in January of this year, that they compared autonomic response testing to IgE allergy panels, and they did find quite a statistical correlation. And then talking more about EMF sensitivity, there's a study from 2017 that showed that there's functional brain MRI changes in patients that are complaining of electrohypersensitivity after long-term exposure to electromagnetic fields. And the study said that most of their patients, or many of the patients, also had a history of exposure to potentially neurotoxic chemicals, especially mold. And in my case, my own case, I had extreme electromagnetic sensitivity to the point that I had to stop working. So at the time when I got sick, I was selling microbiology equipment, robotic microbiology equipment, and it required me to have to set up these big, large machines. And my symptoms were so severe at that time that I had to actually stop working. And then thinking back about my own history, that was exactly the same time that I discovered that there was a high amount of mold in my home. You also want to assess for joint hypermobility, especially something called Ehlers-Danlos syndrome. So this is just starting to be brought up more in Lyme conferences, that perhaps there is an association between joint hypermobility and chronic infections, and maybe even genetic issues like Ehlers-Danlos syndrome. So I will screen for Ehlers-Danlos syndrome in my patients, and I do find that the patients that tend to have symptoms in families are more likely to exhibit some of these hypermobility symptoms. So even sharing my own case, noticing my own family history, we have Ehlers-Danlos, and it seems to be, in my opinion, what I'm noticing is that there seems to be a more increased likelihood of inheriting it if you had a previous generation family member who had Lyme disease. So, I don't necessarily test for EMF sensitivity, but that is a symptom that my patients will complain of, yes. Sorry? Yeah, the ringing in the ears, yes, that's often a sign of neurotoxins and mold toxins and EMF sensitivity. But other things can cause ringing in the ears as well. So I also like to do genetic analysis with patients. So I look at things called SNPs, or single nucleotide morphisms, and human leukocyte antigens to test for genetic susceptibility. So here's just an example of how the genetics can affect your methylation and detoxification pathways. And if you want to learn more about this, I really encourage you to get the book Dirty Genes by Ben Lynch. He's the expert in this field. And then Dr. Shoemaker has put work into deciphering HLA genetic haplotypes as far as increasing susceptibility to things like mold, illness, Lyme disease, toxic algae blooms, and Marcons in the sinuses. So I do use this as a way to determine genetic susceptibility. For example, I happen to be a double multi-susceptible haplotype. That helped, that in my mind gave me a lot of validation for what I went through. It felt like I was going through early onset Alzheimer's disease when I was in my early 20s. And looking at it, I do have the genetics that make you more susceptible to that. So now I'm just very, very cognizant in knowing that I'm going to be more susceptible than your average person to toxins in the environment. So I really take a care in making sure that my environment is in good condition, as well as my own internal environment. So here's Dr. Shoemaker's biotoxin pathway that summarizes how the biological toxins can affect the hypothalamus and the rest of the neuroendocrine axis. And he has treatment steps on how to go ahead and reduce the symptoms that are associated with a chronic inflammatory response. So I do use his protocol as well as other protocols in my office. So one of the things that you have to address when looking at chronic inflammatory response syndrome is the fact that we have a recirculation of bile in the body. So many of our biological toxins are released in the bile, but as they travel through the small intestine, 95% is reabsorbed into the body because we actually recycle our bile. But as we recycle the bile, we are also recycling those toxins. So Dr. Shoemaker's protocol involves using things like bile acid sequestrants to try to grab those toxins as they're traveling through the intestines. And there's other natural agents that can be used to do that as well. So natural biotoxin binding agents include activated charcoal, chlorella, clays, zeolite, chia seeds can even do this. Bile acid sequestrants like cholestyramine or Welchol are prescription ones that are used in the Shoemaker protocol. And then you always want to make sure that you're getting elimination of the toxins as well, especially because binders can be constipating. I often have my patients on some sort of laxative prokinetic to keep the gut moving. Colonics and enemas can be very helpful as well. So I do use conventional treatments in my office quite a bit. So I do see benefit from using antibiotic therapy, antiprotozoals, antimalarials, especially in patients that come back positive for Babesia. I do see that most patients do benefit from antiparasitics. I'll go ahead and rotate through them or treat based on what we find with lab analysis or autonomic response testing. I put a picture up here of a schizosoma because while I was in medical school, we had to practice urinalysis on ourselves, and I actually ended up seeing one of these guys in my own urine and had a huge benefit in my own health when I treated that. And I don't know where I would have picked that up. I mean, I haven't gone anywhere that supposedly those guys are hanging out. Antifungals can be a very important part of treatment, as well as antivirals. So often I'll find that if we're starting patients on antimicrobial treatments and they have reactivated viruses, that their symptoms can actually get a lot worse. So I really like to screen for the viral infections too. So here's a paper by Dr. Stricker that just talks about the long-term antibiotic therapy and how it can improve persistent symptoms associated with Lyme disease. I also use quite a bit of natural and herbal treatments in my patient population. So these are just some of the formulas that I use. Byron White formulas, I really like those. They tend to work really well for my patient population, as well as the classical Chinese pearls. And then other natural antimicrobials like ozone therapies can be very useful, nanosilver. This was a paper I found on the anti-Borrelia efficacy of certain phytochemicals and micronutrients, so I'll often refer to this paper when prescribing herbs to my patients. So they go through some of the plant extracts here and whether or not they go against the spirochetal forms, the round body forms, or the biofilm forms of the organisms. And you can see even things like vitamin B complex has an anti-spirochetal activity, which I never imagined that was going to show up. And then reading this study about how drug combination screens to identify drugs active against amoxicillin-induced round bodies of Borrelia burgdorferi persisters highlight that artemisinin is one of the candidate drugs. And artemisinin is something that we use, or Artemisia, the plant, is something that we use often in treating chronic infections in naturopathic medicine. So Artemisia annua is a very oxidative herb, and that's how it works. So it's, again, working on the oxidative capacity of the body. So how our own white blood cells respond to a lot of the infections is through creating oxidative radicals. So it somewhat mimics that process in the body. And then other anti-inflammatory herbals and anti-infectious herbals. One of my favorite is Coptis. And so this is included in a lot of the formulas that I use, and here's a study that talks about how it helps with inflammation that's induced by lipopolysaccharide residues of bacteria. So using a holistic treatment approach, these are some of the formulas that are offered at our clinic. You can actually find them on this website, returnhealthy.com, that were formulated by the doctor that I work with, Dr. Vosloo. I listed some of the ingredients of our formulas here. We have a foundational formula, a microbiome balancing formula, adaptogen immune formula, which contains adaptogenic and immune modulating herbs, and then a formula for inflammation called ITIS that can help to bring down the inflammatory cytokines, an Artemisia Trinity, which is a blend of Artemisia annua, essential oils, and the actual extract, as well as the artemisinin, and natural binders. We have one called Quench that contains charcoal, chlorella, bentonite clay, and slippery elm. And then vital salt. So I find that many of my patients have problems retaining their salt. So often I'll find just benefit from increasing sodium and chloride in the diet. So this vital salts is just sodium, chloride, and a little bit of potassium as well. And then biofilm treatments can be very, very important in not only preventing future biofilm formation, but then treating the later biofilm stages. So this slide just talks about how you have to use different agents depending on what you're trying to do, prevention versus actual treatment. So here are some of the good prevention strategies on the left, and then I would consider the ones on the right to be more of the active biofilm therapies. So stevia is an herb that's been studied to help with biofilm formation from the Borrelia infections. And then Imprimis is a compounding pharmacy that's come up with a formulation that was made by Dr. Anderson. He created a DMPS, alpha-lipoic, and bismuth subnitrate blend that works to disrupt biofilms. And in attending his lecture, it was very interesting to learn that there's actually one stronger natural biofilm agent that could be formulated, but the US government has a patent on it, then it can only be used for military use. Topical treatments include just making sure that the skin stays really clean, and I often recommend my patients just to use just soap and to keep the skin clean. African black soap I found to be very helpful, especially the eczema and psoriasis version that has some homeopathics in there. And then Dr. Willard's water is a water you can use for to help with healing of skin, but they have it even advertised to helping with to clear up mange for pets, so it can actually help with the Morgellons disease in the dogs as well. And then topical disinfectants. So sometimes I'll use like topical antibiotics or even topical antiparasitics. So rosacea, for example, they now have approved treatment with topical ivermectin. And I find that a lot of my patients do benefit from topical ivermectin or things like Dapsone, which is Axone. And then just over-the-counter things can help too, like Foley medicated first aid ointment, ozonated oils, silver gel, alcohol, iodine, manuka honey. I've heard patients all benefit from those. And then specifically the scalp and hair can be a harder area to address, but I do have a lot of good feedback about the Nioxin scalp therapy. And then different mouthwashes can be important as well. So I do have patients often complain about their mouth being an area that's affected, and the ozonated gum oils and solid licorice extract can really help with that. And then different baths and soaks can be very soothing to the skin. I often will use anti-itch formulas as well to calm down some of the symptoms as we're doing treatments and healing agents. And then immune modulators. So cimetidine was studied recently for helping with the immune modulation aspects to increase the effectiveness of early Lyme disease treatment. I use low-dose naltrexone with many of my patients as a way to help with their chronic symptoms. Okay, and then the vagus nerve connection is important here too. So I think other doctors have touched on this, that the vagus nerve is an important part of the neuroimmune axis. It's connected all the way through our body. So here's a picture of the vagus nerve. And some vagus nerve exercises I'll recommend to patients are things like gargling and gagging, singing, coffee enemas. They all stimulate the vagus nerve. But this is what I was really, really excited to find out recently. I learned this protocol from one of my patients. She is a patient herself of Dr. Nemechek, and Dr. Nemechek came up with a strategy to use what's called transcutaneous vagus nerve stimulation in combination with anti-inflammatory regimen to help reverse cognitive decline, including Alzheimer's disease, dementia, and he's even using the same protocol to reverse autism. His theory is that if you can get the inflammation off of the vagus nerve and then give it enough stimulation, that if you provide the stimulation to the vagus nerve along with anti-inflammatories, that we can actually shift away from a pro-inflammatory response to an anti-inflammatory response, and that can actually help to reverse cognitive decline by helping our immune system to re-regulate the progenitor stem cells that are needed to repair our body. So I'm about to get to that. So here's his case report where he explains the theory he has about the restoration of the neuron repair process. And he was able to get, this is a case report, if you want to go look it up, you can find freely available online, that discusses 2 subjects that were able to reverse their memory decline within 7 to 10 months of this protocol. So the actual protocol consists of 2 hours daily of vagus nerve stimulation, and you do that through the inner part of the ear. So they found out that you can stimulate the vagus nerve through the tragus or concha area of the ear. Before, we always thought that you needed to implant a device to stimulate the vagus nerve. So vagus nerve stimulation devices have been used for patients with seizures. They now just approved a unit for patients with chronic migraines called the GammaCore that can be used externally instead of internally on the neck. But this is another approach to what I would call biohacking the vagus nerve and giving it stimulation. So his protocol is to use the stimulation following a round of rifaximin. So the rifaximin is a rifampin derivative. It stays only in the gut. So the theory is to get the inflammation off of the vagus nerve in the gut so that it can respond to the treatment. And then he's using fish oil that has a higher amount of DHA than EPA. And that's different than 99% of your fish oils on the market. So the higher DHA content is what his theory is that since our brain the DHA content is needed to remodel the brain. So since the EPA can't get to the brain, if we can use an opposite ratio of DHA to EPA, we get a better result. And then he's using curcumin as an anti-inflammatory and acetyl L-carnitine as an amino acid to support memory. And so we have studies coming out showing that not only does transcutaneous vagus nerve stimulation help to reverse certain conditions, but it actually enhances divergent thinking in healthy subjects. So thinking more about Morgellons disease and that we have such a challenge in actually presenting our symptoms to doctors, I'm even hypothesizing that this would be a really good treatment for all of the doctors. that maybe this will make them be able to think a little bit more outside the box. So how does this work? How could just giving an electrical stimulation to your ear really make that big of a difference? Well, the vagus nerve, it's the main component of your autonomic nervous system. And your autonomic nervous system uses acetylcholine as its main neurotransmitter. And you can see here that choline is a huge part of not only methylation pathways, but detoxification pathways, and it's pretty much the main neurotransmitter that runs our body. So if we are able to hack our vagus nerve and be able to get it to produce choline and change its choline pathways, that we can actually get neurological improvement without having to give patients a whole load of supplements. So there's other doctors who are trying to do the same type of process right now using the choline pathways. Patricia Kane has a protocol using phosphatidylcholine and substances that repair cell membranes. And I think that those protocols are great, but this is a way that we can kind of get around trying to just give patients lots of nutrients and IV therapy and actually get the nervous system to do what it needs to do. Although I do still think that dietary choline intake is important for this process to happen. And this is just the last slide I want to share with you is about biohacking the vagus nerve. So this is a device called Nirvana that some doctors have invented in Florida. It was invented by an anesthesiologist who realized that the transcutaneous vagus nerve stimulation helped to improve the outcomes of his surgical procedures. So he and his friends developed this as a Kickstarter. It's a vagus nerve stimulation device that you can plug into any audio device like your iPhone and play music through the device so that it actually stimulates your vagus nerve along with the music. And then the last thing I really want to touch on is that sometimes if patients are not responding to treatment, I'll really sit down with them and talk to them about their spiritual journey, because often there is a mental, emotional, and spiritual part of this that if they're not feeling safe or in their environment, it's really hard for a patient to heal.